Hey Bernie, Tim Handren, your mayor here. Today is March 26th, not May 26th. Apparently when I got home last night, my wife told me I skipped her birthday because suddenly it was May. My apologies for getting that wrong. Some days I don't know what day it is. Coming to you again with another daily update because I believe elected leaders have a responsibility to communicate to their citizens. And that's why I choose to do this every day. I get tired. I didn't know just a couple weeks ago that I was going to be dealing with coronavirus, COVID-19 for 16 hours a day, like I have been for the last 10 days. And I tell you, it is exhausting. I'm sure you're exhausted just watching TV, but I got to do a big shout out. I got this great card from Landry, and he sent me just a word of encouragement. And Landry, I just want you to know that this is what gives me energy in the morning, is I keep this card on my desk. I read it every day, so thank you very much for reaching out to me. So I want to clear up a couple of things so that people understand. We took an action on City Council Tuesday night to extend the declaration for 30 days. Again, that's kind of more of an administrative action that we took. And we extend that for a period of 30 days for several reasons. I don't even know what happens in 30 days. And we just wanted to make sure that we had the declaration in place. Again, that gives us access to federal funding. That's very important for us during this time. And we can at any time rescind that. If things got just cleaned up magically, we would absolutely rescind that. But I don't want people to be confused about what that 30 days meant. If we need to extend it another 30 days or 90 days, whatever it turns out we need to do, we will take that action again. But right now, the orders are in place until the 23rd of April. Now, as of today, I know the governor is going to be speaking today at 2 o'clock whenever you watch this video. I don't know what he's going to say today. So we're going to not try to guess what he's going to say, but I want to provide just a little bit more context. So I have sitting next to me Dr. Ken Styskal. Thank you for being here, Ken.
Oh, you're welcome. Thank you.
Ken is our local health authority, and he is the guy that I've been leaning on for advice in terms of what we should be doing. Now, Ken, you and I met for the first time just about 10 days ago is when I called the emergency meeting on Saturday morning for our community to say, what's our game plan?
Mm-hmm.
I had never met you before then. Maybe you could just describe what it is you do as a local health official.
Sure. My official role is the medical director for Kendall County EMS, and I've been in that position since about 2002, I believe. It's been a while. I'm also an emergency medicine doctor, and I practice primarily in San Antonio, so I work at about 3 or 4 different places in the San Antonio area in the local ERs.
Great, thanks for that. And I have to tell you, you've been a huge help to me because, just 4 weeks ago, I was looking at an email I sent to my board of directors where I work in San Antonio. I sent an email that said, this coronavirus thing, it's completely blown out of proportion. There's only 53 cases in the U.S., and I was comparing it to the flu. And looking at how many people get the flu and how many people die from the flu, but this is not the flu. This is a completely different thing.
Yes, it's different, and the biggest thing is that we don't know much about it, and so we're learning things as we go, and we just don't know where it's going to head. So,
I would even say 2 weeks ago I thought this thing was a hoax, but just 4 weeks ago there were 53 cases in the U.S. and today there's almost 52,000 was the number I saw this morning.
yeah.
And it wasn't until that Saturday morning meeting that, and I got to give you a ton of credit here, you were the one that convinced me that this is very real. Have you always been in that position?
I really haven't. I have to admit I was kind of like you were in that I was, and a lot of, I think, doctors and healthcare workers were like this, and at least initially, that it was not as big a deal. It would probably just kind of pass through and not grow like it has. And so I was more skeptical, and I've really actually, over the last 10 days or so, 2 weeks, I've really come to realize that it is a big deal. It's something that we have to deal with, we have to embrace.
And it's not really about death. That's not what the big concern is here. A lot of people are going to get this. They're going to be just fine. A lot of people are going to remain asymptomatic. Right. The real concern here is not the number of people that are going to die, because probably, from what I'm reading and what you've told me, fewer people will die than die from the flu, probably.
Yes.
However, what's the real concern?
Well, the real concern is that how fast it hits, and it's how well it spreads, and that we talk about blunting the curve, basically. And so what we're talking about is trying to spread out who gets what and at what time, and we're trying to spread it out over time instead of having it hit at one peak. If it hits at one peak, it overwhelms any healthcare system, even our own. If we can spread it out, that way we can take care of people, let people recover, and then other people can be taken care of. The same amount of people are going to get sick or get the virus. It's just a matter of the timing is what's most important.
You've been incredibly helpful to me. I have a real sense of urgency because I see how fast this thing is growing. And in my almost daily conversations with you, you've been very helpful. Now, you've just been giving me advice. Your job is to advise. You advise me. You advise all the elected officials in Kendall County. Your job is not to decide or to judge, but I always check in with you. Anytime I make the last 3 declarations, I've checked in with Ken every single time.
Yes.
I'm not a medical expert. I don't pretend to be. But as we've had these conversations, I have to, in the role that I'm in, and let me just be clear, this is a volunteer role. A lot of people think that I'm part of the government and I get paid a lot of money. The mayor of Boerne gets $200 a month. I don't pretend to be an expert on things, but I rely on experts like you. And we have to make a balancing decision. And this has been very difficult for me, and why I take it so seriously and why I have to read as much as I can, consult with experts like you. I have to choose between health or economy. And I think at the end of the day, I choose health over economy, because if I don't, and I don't act appropriately, the few deaths that may happen in Kendall County, those people will never forgive me for not choosing health.
Yes.
Economically, we're going to recover.
Yes.
I know it's a short-term pain, but thank God the Senate passed a bill or a stimulus package last night. Hopefully that will make it through the House as well. That gives us that economic recovery.
Yeah.
I don't know if you have an opinion about that or not, but health, you can never go back and fix health.
Right. Let me just preface this with that I'm not an economist or a politician or anything like that. My opinion is that I lean towards health, and I think then the economy is a secondary issue. But I think that by shutting things down and limiting things and feeling a little bit of pain economically now will make it set up so that we will be better off in the future, and I can't say for sure how long that'll be, probably months, probably a few months, if not more. I think that'll set us up to be able to get back to what we normally do, and I think the economy will probably come back pretty quickly, especially with what the U.S. government is doing as far as the stimulus package to help people through until that time when things open up and things get back to normal business.
Yeah, I agree with that.
Yeah.
We were talking earlier, just watching what Governor Cuomo is having to deal with in the state of New York, and the speed and the velocity of what has happened there, and watching him in his press conferences. Can you just talk about what happened there to their health system and the shortage of beds and some of the things that they're facing?
Yeah, so New York is such a hugely populated area and densely populated area, and it's very international with people coming and going from all parts of the world. It's a perfect setup to spread something like the coronavirus. And you just have to remember, this virus is, when you get it, many people are asymptomatic for several days, even up to 2 weeks. They may never have any symptoms at all. And that's dangerous if you think about it, because then without you knowing it, you can spread it to other people. And the fact of the matter is that in 10 people, you're around 10 people with close contact, 2 or 3 of those are going to get the virus from you. And if you continue to think about doing the math from there, 2 or 3 more people will get it from there, and then it just kind of blows up exponentially. And you can see why there's this huge spike. And then again, like I alluded to before, the spike overwhelms any kind of healthcare system, even like a big place like New York, where there's multiple hospitals, multiple doctors, many people there. It overwhelms the system, and it's just not set up to take a mass casualty kind of scenario like this is that quickly. We just don't have the equipment, the doctors, the nurses, everybody involved in that. We just don't have enough of that to take care of the patients.
The nature of this virus, it's more of a acute respiratory disorder is really what this is. It's not a flu in terms of how it affects the body, and that's why you hear a lot about ventilators right now. And Cuomo was expressing in the last couple of days he needs an additional almost 30,000 ventilators for what they are seeing coming. Yeah. I talk every day with either Nelson Wolff or Ron Nirenberg in San Antonio, because that is our medical system. We're going to, as Boerne, I know we don't like to say we're part of San Antonio, but we are for our healthcare system. And in talking to those folks and listening to them getting ready, and they're getting braced for what's coming in San Antonio, because in New York, it's doubling every 3 days. In San Antonio, it's starting to see that same kind of doubling in every couple of days scenario. Do you have a feel for how San Antonio is equipped if it goes on the path that we're on, which matches New York, or if we're on that New York style path? What would that mean to San Antonio?
I really believe that if it goes up like it did in New York, San Antonio is going to be in the same position. We're going to be with lacking the complete number of ICU beds we need, the number of ventilators we need. We're going to be in similar situation, even though we've had a little bit more time to prepare. It just I just think it would probably really tax our local system, the San Antonio healthcare system. Even though it's quite robust, I think it would tax it quite a bit. That's
what I'm hearing from both Nelson and Judge Wolff and Mayor Nirenberg. And we don't know what it is. Is it going to be 20%, 40%, 60% get it? That's what we don't know. We're trying to prevent that by keeping our distancing guidelines. Yes. I've seen some estimates that if it's in that 40% of the population in San Antonio gets it, recognizing how all the math plays out, the beds in the hospital system in San Antonio may be short by as many as 2 times, similar to what New York is facing right now.
Yes.
So that really gets to, for all you folks that are watching this today, that is why I have a huge sense of urgency and why I'm trying to be aggressive. I know there's some people out there that think I'm abusing this power. I think if I didn't do anything, that would be abuse. Sitting and doing nothing to me is irresponsible. And so that's why I've chosen to take the actions I've taken. And Ken, I just want to, Dr. Styskal, I call him Ken because we talk so often.
Yeah, no worries.
I just want to I wanted everyone out there to know that you are hugely important to me. And the actions that we're taking, I hope that we're doing all the right things. We've heard some quotes out there. If it feels like you've gone just a little too far, that might be just right, but you can never make up for not going far enough. And I appreciate you advising me and helping me as I go through the decisioning process.
It's been my pleasure.
That's all for today, folks. I'll continue doing these updates as long as it makes sense. I hope I don't do these till the month of May, but again, today is March 26th. That's the update for today. Thanks for tuning in.